So I'm Mark Van Passel. I'm a molecular microbiologist, but I ended up in policy, which is also interesting. And because I'm a molecular microbiologist, I thought it would be good to show you this one first. So in September 2005, there was a plague caused by an infected pet's zoonosis, which caused a pandemic. But I'm pretty sure that none of you have heard about it. It was the corrupted blood incident. It affected millions and millions. But death in World of Warcraft is not permanent. There was a infected pet in the game. Millions of players played the game, and from the pet, it actually transferred to human players on servers. It spread very rapidly. So major towns and cities were abandoned by the population as panic sets in, and people rushed to evacuate to the relative safety of the countryside. I think this sounds familiar. This was actually studied by The Lancet about the untapped potential of virtual game worlds to shed light on real-world epidemics. And it's absolutely a wonderful paper. It's really old already, but it's a wonderful paper to read. And you would think that we would have taken the lessons from that off-world pandemic, but I'm not really sure whether we did. In the Netherlands, we did realize that public health in the Netherlands is linked to global developments like pandemics, climate change. There's increasing interdependencies, and there's increasing inequities. Fortunately, we have a very famous philosopher in the Netherlands, unfortunately passed away, Johan Cruyff. He's actually a soccer player. And he said, vaak moet er iets gebeuren voordat er iets gebeurt, which translates as often something has to happen before something happens. And of course, the pandemic happened. And in 2020, we were all in crisis mode. Many of you will definitely remember that very well. And through parliamentarians, we actually had a, what's the actual name? Advisory Council on International Affairs advising us to what to do. What do you need to do as government? Because we said we want to have a global health strategy, but it's not always easy to work with the different departments. So they gave us advice: adopt a coherent global health strategy, balance health security and access to care, invest in global health as both a moral obligation and a strategic interest. It's not only good for the world. If it's good for the world, it's also good for the Netherlands or Sweden or Germany or Spain or any other country. And strengthen multilateral cooperation with international and local partners. So in October 2022, the launch of the cabinet-wide Dutch Global Health Strategy was launched with the title, Working Together for Health Worldwide. It's very similar to the slogans we've heard of the different other global health strategies, which is very reassuring. So the objective is to contribute in a coordinated and targeted way to improving public health around the world, and thereby also for the Netherlands. Efforts are based on the UN Sustainable Development Goals. You've probably seen the pin. It's also included in their Sustainable Development Goal number 3, good health and well-being. And we tried to set up a strategy like that. To ensure maximum effectiveness, priorities are based on global challenges, and I realized the global challenges were very different when we devised this than the global challenges we're currently experiencing, and added value of the Netherlands. So what can we bring to the world, and what does it bring us? We had 3 different roles to play: a connector promoting multi-sectoral cooperation, an innovator sharing knowledge, experience, and expertise, but also as an advocate championing multilateralism and defending human rights. All right. So now we get the infographics. Those are more simple. There are 3 priorities. There are 3 priorities in the Dutch Global Health Strategy. One is strengthening the global health architecture and national health systems. Obviously, we do this together with the Ministry of Foreign Affairs. Ministry of Health and Ministry of Foreign Affairs go hand in hand, but they have different roles to play, also different objectives sometimes, but they merge somewhere. This was a little bit more Ministry of Foreign Affairs, international coherence and multilateral cooperation, but also improved access to primary healthcare and sexual and reproductive health and rights. The second one is very similar to what Sweden just promoted. There's 3 priorities, so brace yourself. The second one is improving international pandemic preparedness and minimizing cross-border health threats. So we want global access to medicines and health products. You may have noticed that the Netherlands hosted the World Local Production Forum in 2023, if I'm not mistaken. We also want strengthened international action on antimicrobial resistance and zoonotic disease policy. AMR also came back in the Swedish global health strategy, which is no surprise. We've been working on this topic, both of us, for quite some time. And the interesting part is that with the current developments in abrupt cuts in international development, for example, by USAID, may actually lead to increased AMR also in HIV and tuberculosis, which are predominantly topics that our Ministry of Foreign Affairs has worked on, but it coincides very much with the antibiotic resistance that the Ministry of Health works on. So we are always looking for topics that we can collaborate on. I didn't do that. All right, 3, addressing the impact of climate change on public health and vice versa, making healthcare more sustainable and climate resilient, international action on climate, water, and food. You may have seen that last year, the Netherlands was one of the co-organizers of a resolution at the WHO in the relationship between climate and health. I'm very happy that this year a plan of action was being adopted also at the WHO. All right. So this is the infographic. I'm pretty sure I can share this presentation with you, so I'll make sure that you see it. The infographic is also very simple and straightforward. Basically, the presentation I just had with past were just snippets of this infographic. So what do we do as a global health strategy? The global health strategy is a cabinet-wide, but it's not owned by civil society, but we do need them as the other, as of course we learned from Germany. Some countries were earlier with global health strategies, so that made things easier. We also have a global health hub to contribute in a coordinated and targeted manner, improving health worldwide, and therefore also in the Netherlands, we need input from civil society. Actually, we call this the Dutch diamond because it has a really weird shape, but we have academia, private sector, government, and what was the last one? Civil society, I think. Civil society, private sector, academia, and government. 4 pieces, and in the middle they come together in a diamond shape. We try to have all of them on board in our Dutch Global Health Hub, and it seems to be working out really well. For example, last week we had a meeting with civil society and academia on sustainable and responsible licensing, because there were questions from Parliament, and our partners in the hub were very, very interested in this. So we organized a meeting like that. There's the Dutch diamond. So we want to bring together key actors from all sides. We also have youth groups in there, very similar, of course, to Germany. I'm pretty sure we peaked to your strategy when we devised ours. Seize the opportunity to align efforts and implement this strategy collaboratively, and ensure coordination, foster innovation, and avoid duplication. And avoiding duplication is quite difficult because there's so many initiatives. And this fragmentation is a real concern, I think. All right. In this global health hub, we have communities of practice, and we've transferred the coordinating power to the chairs or the COP leads, the community of practice leads. Obviously, these are the same topics as we have as the priorities in our global health strategy. So strengthening health systems, pandemic preparedness, and climate change and health. And they organize their own meetings. We join them, we facilitate where possible, but basically it's owned by civil society or the global health stakeholders. Of course, we also produce a newsletter. For example, we always take a youth delegate to the WHA, and they can reflect on urgent issues that is more seen in other venues than government. We also prepare the Dutch stakeholders what's going to happen at the WHA, and we inform them, we take them aboard. And of course, there was a recent WLPF, World Local Production Forum, recently, and we also try to explain. We try to inform as much as we can. Let's see. Okay. So the first one was the Global Health Hub, how we collaborate with stakeholders. The second pillar of this global health strategy is the Global Health Partnership Program. These are government-to-government projects. This is just for countries that we work with. There's a few more I'll show you later. It has to be demand-driven. We're not going elsewhere and say, you know what you got to do. That they have to say what they have to do. That they have to say, we need this. We just give the framework of what we can, and they can say whether they have a need that they would like to collaborate with. It's mostly technical assistance, but it could also be capacity building. So we also have a little infographic on this one. It's very similar. As you can see, we're working together with several countries. Sometimes it's more countries, sometimes it's a few countries. Obviously, with some countries, we have a special relationship. You may know that the Netherlands, the Kingdom of the Netherlands, consists of 4 countries, 3 of which are in the Caribbean. And especially during COVID, it was so clear that they have very few resources, medical resources, because they usually rely on Colombia. And Colombia also closed their borders during COVID. So there was a huge need for support. And we reciprocate help with Colombia by doing partnership programs. But we also work with South Africa, the Netherlands in there for good measure, Kenya, India, China, and Indonesia. Actually, the United States is also in here, but it didn't make a nice picture at the moment. So this is what it looks like. We work together, for example, with, do I have a light? There it goes. So in Colombia, we partner on the One Health approach through a tricycle protocol, very much working on AMR. In Kenya, we work on developing guidelines for sustainable healthcare facilities, very much in line with our 3rd priority, climate and health. In South Africa, we're working on wastewater surveillance, something that we do very elaborately also in the Netherlands. In China, we work with reducing hospital CO2 footprints. And the interesting part about this is that even though we're not the Ministry of Foreign Affairs, from the Ministry of Health side of you, of course, but we do have health delegates in the different countries. For example, in China and in India, and we had one a couple of years ago in Indonesia. So we usually work with countries where there's also a health delegate because it makes much more sense. We also work with other countries. It's not a necessity, but it does help. All right. So the next steps, we should also do an evaluation. However, our government just decided to have new elections in the fall. So it's not really the best time to reevaluate the global health strategy when we don't know what's going to happen next. But we will do that because in our Dutch global health strategy, it says in 2025, we have to look at what's happening in the world, and maybe we have to realign or readjust the direction that this is going. And we do read the newspaper, so we know that there's different challenges worldwide, and we are addressing these at the moment, but just not in a full-fledged evaluation. So how to deal with further fragmentation of the global health landscape. This morning we heard, for example, from the World Bank. I think the Pandemic Fund had a meeting last week, but there's also pledging events of the Global Fund or of Gavi, or I think CEPI is coming by next week. They have different roles to play, but there's also overlap in that. And sometimes it's very difficult to see what the global health landscape looks like and how to navigate it. Okay. And we have to, especially in our Global Health Partnership Program, we have to build on existing partnerships because a longitudinal relationship works really well, established relationships, but sometimes we can also expand. So we've just secured funding for the next, the Global Health Strategies from 23 to 30. We just established funding for 26 to 2030. So we have to look into what opportunities there are, or what mutual beneficial relationships we can build on. I think this is what I had in mind. Oh, of course. I want to end with my famous soccer player, Johan Cruyff. This is actually graffiti next to the place where my daughter dances. It says, alleen kan je niks, je moet het samen doen. So all alone, you can't do anything. You have to do it together, which is a great soccer motto, of course, but it also really works for global health. Thanks.